Well, back in early 2000s, 2003, 4, I was very interested in neurology, in MS. It's one of my I'm a general practitioner, but I have a few special interests. And I wasn't happy with the drugs that were being used in multiple sclerosis. They seemed to be heavy duty drugs. They caused a lot of side effects. People couldn't stay on them very often. I'm talking about the beta-ferrons and Copaxone and drugs like that. And also, I wasn't impressed by their success in the sense that they may have reduced the frequency of attacks in relapsing, remitting multiple sclerosis. And I accepted that was true. But I don't think they stopped the progression in any way. So I was looking for something that might do that because it seemed to me a progressive neurological condition. And I read an article on the Irish Times, actually, written by Mary Boyle Bradley, who subsequently wrote a book called Up the Creek with a Paddle, which is about LDN. And she was living in New York at the time, and her husband had MS, and he was on the beta-ferrons. And she had come to know a Dr. Bernard Bihari, who was a neurologist living in New York. And at that time, he had been research doctor for the AIDS crisis, and he was looking for drugs that would affect the immune system, because of course that's what happens with AIDS and HIV. Your immune system crashes. So in the pursuit of that, naltrexone was discovered and produced to help IV drug users. It was a morphine agonist, and it would replace the morphine. If people took an injection of heroin or morphine, they didn't get any high or buzz from it, but you used it in high dosage, 50 milligrams, and it was quite successful. And he was a part of that research, Dr. Bihari. Now, he had a big budget. He had a lot of students that he was comparing the drug with the people with HIV. And he noticed that when he reduced the dose, because he wasn't quite sure of what the dosage should be, but when he reduced the dose, the effects of LDN changed. He was measuring the endorphin levels to try and figure out what was going on in the immune system of the patients. And he noticed that at low dose of naltrexone, the endorphin levels often tripled, which was a surprise finding. He certainly didn't expect it, but he noted it, and he checked it a few times, and this was true. So he thought that the low dose, while the same drug, naltrexone, had different qualities of action and could be used maybe for different things than the high dose. The high dose blocks the endorphin sites 24 hours a day. The low dose, apparently after more research, blocks it only for a very short time, 2 or 3 hours, and there's a rebound phenomenon then by the brain and the endorphin centers where they produce a lot of their own endorphins. So it stimulates the body to produce their own and therefore improves your immune system.
Fritz Bell was a doctor who was using LDN and histamine therapy in his wife, and he found that very successful, and I subsequently looked up a number of websites and other emails from other patients who've been using LDN, and I found everything about the treatment method was supportive and positive, and this I found very encouraging. Subsequently, I spent the following year both testing and further investigating LDN use. I tested it extensively on myself, found positive results, ultimately decided to purchase 5,000 capsules of LDN from a pharmacy in New York. And with these, I effectively advertised the use of LDN by writing an article in a magazine called New Pathways, the magazine of the MS Resource Center and MS Charity. And with that, I gained literally hundreds of patients who already obviously knew about LDN and simply wanted a source of where to obtain it. Since that time, I've never been able to give up the idea, and the method has simply snowballed ever since. We now have about 500-600 patients on LDN for many different reasons, mainly MS, but also other autoimmune conditions like ankylosing spondylitis, colitis, Crohn's disease, Sjogren's syndrome, dermatomyositis, rheumatoid arthritis, psoriasis, etc. There are many autoimmune conditions, and also a number of people with cancer, the most dramatic of which was a gentleman with lung cancer that was considered terminal. He was given effectively 3 months to live, and that was 7 years ago. He's been on LDN ever since, and the cancer has simply shrunk away and disappeared, and they can no longer find it. And he's still alive, fit and well, with no problems at all, and remains on LDN that he's now receiving from his GP.
The current mechanism of action of LDN is widely debated. There are many studies showing that naltrexone not only works on the opioid receptors for which it's licensed, but on multiple other receptors and biological systems. There's two main sort of stays of thought. One is that it boosts the amount of something called methencephalin, which is a natural happy hormone in your body. So that's an endorphin boost. And that appears to have an anti-inflammatory effect. So that's one of the most long-standing theories. Alongside that, it's been found in a number of studies in test tubes, that's in vitro studies, that the LDN will actually bind to a receptor called a TLR receptor. Now, TLR receptors are involved in the first point of the immune cascade for when, for example, you're attacked by a bacteria or a foreign body. So the idea is, in this theory, that the LDN is suppressing an inappropriately stimulated TLR system that is starting a cascade which then affects, for example, myelin, or causes an autoimmune reaction to continue on longer than it should.
Well, LDN is a very interesting agent for treating an array of different conditions, and currently it's being used as an off-label medication, certainly in the United States. And primarily it's for chronic medical conditions such as multiple sclerosis or fibromyalgia or gut issues. So for example, Crohn's disease, inflammatory bowel disease, or irritable bowel syndrome are the areas where it's being employed in an off-label manner. While it's unlikely that pharmaceutical type research with large randomized controlled trials will happen, I think that there is increasing interest in doing clinical studies which will broaden the scope of use and hopefully encourage other practitioners to utilize the medication. So I think that the future is bright for the use of LDN in chronic medical conditions, but we still are challenged by the fact that the traditional model of research in the medical field right now is not something that we're seeing a lot of activity with this medication, just simply because of the economics.
One of the criticisms that have been leveled against low-dose naltrexone for years is, but it's unpublished. There are no publications to show that this works. I gave a presentation recently in the United States, and I did a PubMed search, and there are now 83 publications in PubMed specifically on low-dose naltrexone. So there's a small and growing number of publications on the use of low-dose naltrexone. There are very enthusiastic physicians, very committed to low-dose naltrexone because we've observed clinically what it can do. There are nice publications for fibromyalgia, and there's a fantastic publication by Professor Jill Smith in using low-dose naltrexone for Crohn's disease. Her first publication was in the American Journal of Gastroenterology, and her next publication was in a much lower-ranking journal. And it's disturbing when you see a randomized, placebo-controlled trial published by a professor from a prominent university that doesn't get published in a high-impact journal. And I really struggle to understand why a journal like the New England Journal of Medicine wouldn't publish something of that quality when you have a medication that's very inexpensive and potentially very beneficial for lots of patients. And the sad thing is, until these big journals decide to publish the data, the little publications don't have as much impact as we would like. So why it is that the big journals don't publish, I guess there are lots of different theories about that, but it's disturbing that it's not happening.
Doing research in a clinical basis is actually quite challenging. It's very time consuming, and it actually is quite costly. So to do a simple study where you review your practice, of course that's the easiest one to do, and it's the most likely one that you'll see in clinical based practices. But to try and do a randomized controlled trial is a very daunting task. That takes the level of involvement and finances to a completely different level. That type of study, I personally don't see how you can do that without having sponsored support, whether that comes from the government, private industry, etc. There obviously needs a large capital investment to pull that off. So that's basically setting the bar too high for most clinical practices to even entertain that. Really what we've done is we've demanded so much in terms of the level of involvement and the quality parameters that are required for a randomized controlled trial, that only the very elite, so in other words, academic institutions, major corporations, actually can do the studies. So that unfortunately means that we're seeing less and less novel research because those entities have vested interest in the type of research they do. But many breakthroughs in medicine have come from doctors working in a clinic, doing something novel, taking something that deviates from the traditional approach and discovering that it actually has an application that we never realized. And so that's one of the challenges we face in our modern world, is that type of research is happening less and less and less.
And so I started using it in MS, and that's in 2004 or 5. I went to the first conference in 2005 in New York and met most of the people who were in the LDN business there, including Professor Garoni, who's a professor of neurology in Milan, and who repeated the work done by Dr. Bihari, and discovered that the endorphins were lowest in people with primary progressive multiple sclerosis, for which the neurologists tell us that there's no treatment. I give all my patients with this condition LDN, and they're all got better and they're stable.
So the forms of LDN that we have in the UK that we know are safe, well controlled and come from a known source are the LDN liquid, 1 mg per 1 ml, LDN sublingual drops that are 10 mg per ml and they're used under the tongue, LDN capsules in 3 mg and 4.5 mg strengths, and also there is an LDN cream which comes in 0.5 mg per 1 ml. So within that range there usually is a formulation that will work for you.
And I have had very great success in some conditions, particularly fibromyalgia, which is an acute pain syndrome. Again, it was thought to be kind of psychological at one stage. We now know it has to do with a more inflammatory situation in neurons, in the glial cells maybe, etc., in the brain, and the increase in cytokines. So we're getting to know a lot more about these conditions, and they're genuine conditions. LDN in fibromyalgia has dramatically improved most people, and Stanford University, who has done some research in this, has proved that and advocated its use as a primary agent.
Yeah, the pain started to build slowly, so I started having pain down one side, and then slowly that got worse and worse, and it spread everywhere, and I thought it was my mattress. So I bought a new mattress and realised that mattress was even worse. And then after that mattress, I bought another mattress, and so on, till 10 mattresses down the line. A lady said to me in a shop, if this mattress doesn't suit you, then there's something wrong. And I thought, that's a bit cheeky. But however, I thought, well, you know, this one's probably going to be okay. But that was actually the worst one of them all. It was horrendous. And I ended up going to the GP and explained to him what was happening in floods of tears, and he said to me, where are you hurting? And I said, I'm hurting everywhere. There's not part of my body that doesn't hurt. It literally felt like I was bruised all over, like I'd been beaten up. And he said, I think you've got something called fibromyalgia. And I said, right, I had heard of it briefly, from one of these ladies in the mattress shop. Her daughter was diagnosed with it and she'd had trouble sleeping on a mattress. So he said, but to get it confirmed that that's definitely what it was, I'll send you to a consultant, and he advised me to go private, so I did. And this consultant was a lovely guy, and he confirmed the diagnosis. And that was that. And then I had to go and see my GP again, and he prescribed me some antidepressants, because that was what you got. That's what you got prescribed for fibromyalgia to start with. There were certain ones that were better than others, but I got prescribed different amitriptyline, I think it was, that I got prescribed. And I went away and tried to take this, but my body actually at that point would not tolerate medications. I got the worst side effects that you could get from the medications. So that GP prescribed me a whole host of drugs, none of which my body could actually tolerate. I used to get very, very terrible side effects, like the floors would be moving. I would be in worse pain. And I wasn't sleeping at this point. I was probably averaging about 2 hours sleep a night. I was on painkillers constantly through the night, so I would be taking alternating painkillers, ibuprofen, paracetamol. He prescribed me tramadol, which I tried not to take if I could help it, but really I did need it because the pain was so bad. And during this time I was trying to look after these little twins, my twin daughters, who at that point would have been 1.5, maybe, 1.5-year-old. So that was very difficult, because the other thing that was happening to me as well was that I was becoming less energetic. My energy was, I didn't have any energy, so I wasn't able to walk very far. So sometimes I would take the twins out in the buggy, and then my legs would just collapse from underneath me, and I would just fall to the floor. And then I wouldn't be able to get back up, and I'd only be trying to get to a class with them, or maybe just get to the shops, but I was never quite sure if I was actually going to make it to the shops and back. After that, things worsened and worsened to the point where I would wake up in the mornings and I couldn't really see. So I was still trying to look after the girls, and I wasn't able to work at this point. I was able, some days I had more energy than others, and it seemed to wax and wane, and some days I would have more energy, but I would have less cognitive function, and other days I would be more cognitively okay, but not be able to hardly walk. There was times when I couldn't sleep through the night, and I'd get up like really, really early in the morning, 3 o'clock, 4 o'clock in the morning, and I would get the phone book out and I'd be looking for help, like the Samaritans, and just anyone that I could get help from, because I just was so low and felt so ill and so depressed, and the GPs were not really able to help me much. They didn't really know what to prescribe me. There was nothing out there really for fibromyalgia apart from antidepressants and painkillers. I read about low-dose naltrexone in a book, and the book was on the thyroid, but it did mention fibromyalgia in this book. It said that it could help in the 4 areas, and then I didn't really think much else about it after that. Things worsened a lot. I went back to see a private consultant again because we were so desperate for help. And the consultant said to me, "Why have you not taken any of the drugs that I suggested that you took last time?" And I said, "Well, my GP hasn't offered them to me. And any time I've asked, it's just like you just face brick wall after brick wall after brick wall." And he said, "Right." I said, "Currently at the moment, they're waiting to see this report from you to see if I actually have got fibromyalgia, because they actually still don't believe that that's what it is. And I feel that they think that my problems are all in my head, that they're all mental issues." So he said, "Absolutely not. You're the worst case that I have ever seen. Cognitively, the worst case I've ever seen, especially because by that point I couldn't really see, and I really, really struggled to even focus on him." So I asked him about low-dose naltrexone as well, and he said I showed him some information that had taken off, the internet, and he read it, and he said because it was only a pilot study, he wasn't able to prescribe it for me, but he would have been more than happy to prescribe it if I'd found somebody willing to, he was happy to refer me to somebody that was prescribing it. He would have been quite happy to do that if I got back in touch with him, which was very, very nice that he considered that, because any other GP that I mentioned it to said there was absolutely no way that you will get that drug from us. And I tried a few GPs, and again, it was just like hitting a brick wall. None of them felt brave enough to take the risk to prescribe it, even though the side effects are very, very minimal compared to a lot of the drugs that I was already being prescribed by the GPs. On the drugs that I was taking off the GP, the antidepressants, they picked me up enough to be able to use my laptop to be able to do some studying on low-dose naltrexone, and I eventually found a GP in London that was prescribing. There was a few around the country. He was prescribing from a clinic in London, and he was happy to do a consultation with me over the telephone. So he asked me a few questions, like what I hope to achieve from taking the medication, and I said, well, if I get any improvement at all, then that would be brilliant. If not, then obviously I haven't lost anything. That was what I felt. And he said, that's a good attitude to have, and I'd be happy to prescribe it for you. So nowadays, life's very, very different from those 3 years where I was very ill, and I'm able to, I would say, live a very fulfilling, normal life like everybody else, really, that's fit and healthy. So I was able to do work on my house, which I wanted to do. I enjoy doing that in my spare time, and just do normal everyday tasks like washing the dishes. I'm able to stand at the sink, which is something I wasn't able to do, or I could but not for very long. Even just like manage to get from room to room without crawling. And I would say on low-dose naltrexone, I feel much better than I did before I was actually diagnosed as fibromyalgic. What makes me frustrated is the fact that there are GPs out there that are able to prescribe this drug if they feel it is of therapeutic benefit, yet they won't take the risk or even take the time to research the drug to see if it would be of benefit to that particular individual. And even at times when I've handed information over, they have said, there is no way that you will receive that drug from this practice.
My name is Brian Udell. I'm a physician, and my specialty is pediatrics. My background is that I've seen children as a neonatologist since the 1970s, and that's babies who were very premature, very sick. And most of those babies in the 70s that I were taking care of was a lot of cocaine and drug-addicted babies, alcoholism. And then mostly as the 90s came in, it was mostly children who had cocaine and other stressful pregnancies. And it really wasn't until the 2000s, 2008, that I started seeing children with autism and got interested in what now looks to be the autism epidemic. And when you start to search for what's the autism epidemic, you realize that it's real, that since I was the medical director of the follow-up clinic, all those years that I saw high-risk infants, I didn't see autism until it all of a sudden started emerging around 2008 for me. And at that time we were seeing 7 children a week, and now I could see 10 children a day. So the diagnosis doesn't really matter. The diagnostic criteria don't really matter. What matters is parents are coming to us because they have children who are not developing normally, and the regular medical community, the conventional medical community, doesn't seem to get it. That it's not only they don't even have the answer. So the parents that go searching for answers are going searching for answers that the medical community says itself that they don't have. Specifically, speech apraxia, the inability to speak. There's no medicine for that. Social isolation. Kids are in their own world. They're in a fog. There's not really medicine for a baby for that. And repetitive movements, okay, which are not seizures. They are some kind of behavior that we don't understand called stims. And so those three things make up a core of symptoms that we call autism. And in 2006, Dr. Jacqueline McCandless came out with a paper that said that low-dose naltrexone was a valuable tool to be used. And I've been using it since about 2008 or 2009, and it's been very successful. And what I mean to convey to my parents is, I didn't realize, for example, when I started doing autism, I didn't realize that naltrexone was even available to us. But it's one of the few drugs that's listed in the pharmacopoeia as being on label for autism. The word is in there. And autism doesn't show up in a lot of treatments. And it's very simple to give, and it's very inexpensive, and it's effective in a lot of cases. And I think that the trick that every doctor is trying to figure out as we get older, they call it practice for a reason. And as we're practicing and getting better, what I'm trying to figure out is what works in who. What medicine should be applied to which specific patient. And there's not one kind of autism. I see 15 or 16 different basic variations of autism. And then within that, there's other things that are different. And so it's a very complicated condition. It doesn't have an easy answer. Symptoms are the main thing that we're attacking right now, not necessarily what the most upstream problem is. And LDN, low-dose naltrexone, has for me, proven to be effective in children who have aggressive behaviors and in children who have very disruptive behaviors. That tantrums are a big reason, and their immune system is affected. So just like Dr. McCandless wrote about in 2006, it's for immune modulation. The paper that she was writing was for immune modulation to help the immune system, and mood disorder, or some of the word like that she used. And whenever I show it to a parent, I always say, doesn't this look like your kid? Okay? And that's when they give it a try. And so when it was invented, Dr. McCandless realized, so it was, first of all, it was started in the 1980s. The whole idea was brought up at the first time in the 1980s, so that's almost 30 years ago, that it's had thought put into it, how to figure out the dosing. Thought has been put into it about what the mechanism is. Prospective, randomized, control studies have been done. Some of them do show a difference. Some of them don't. Most of them show the best difference in aggression and some of the behaviors, which is what I pick it in. When you use those criteria, I feel that this 2006 paper was important because she realized that it's very bitter. It's hard to give the medicine to the children, so it has to be given after 9 p.m., between 9 p.m. and 12 a.m. She's very specific about the immune modulation. And frankly, I'm pretty ignorant about how it's used in cancer and other patients, but at least for us, this was what was proposed for doctors who take care of autistic children. And so the dose is given as a cream because most kids are asleep by the time 9 p.m. comes, or should be asleep, and the taste doesn't matter. And when it's given that way, it's absorbed into the body at the correct time. And I would say, something like 20 or 30% of my patients that I give it to seem to have enough of a response that they continue to get it, which is the only way I can really understand whether a patient thinks it's helping. Some of the patients just keep giving it because they say the kid stopped getting sick. He was getting sick every year, and it seems the immune system is really boosted, and that's a good enough reason for them not just to continue the medicine. And some of them, like Jacob, the mom feels that when it's left off, she feels a big difference in how he's behaving. So it's very benign. It's a low dose. We know what to look for. and it's been given for a lot of years. And for all those reasons, I believe it's a great choice when you're faced with just about bad choices or no other choice in autism. There's a certain type of patient that's getting sick all the time, and I can't understand why they're getting sick all the time. Nowadays, kids go to school much earlier. They're in daycare, and they get cooties all over each other all the time. And so I'm kind of used to it, but he was really getting sick, and he had a lot of behavioral issues that I felt like if I used the regular therapies, they would be too stimulating to him and make his negative behaviors worse, his tantrums worse. And so the mom wanted us to use something we use a lot. Wanted us to use B12. I have a protocol that includes a lot of methyl B12, and that's a pretty successful protocol when you're looking for some help in autism. But because I just felt his immune system was so involved, and that I wouldn't be able to be successful with something that jazzed him up more, that it would be a good try. And she reluctantly, I think she'll tell you that she reluctantly gave it a try, and it was really day and night for that child. And I am aware that many of these documentaries are only anecdotal, so I don't want to promise that for other children, but I do try to pick it in the children who seem to have some special skill that is like amazing, and he already demonstrated some special skills, much smarter than you would think, much more clever. They figure stuff out, and then they're getting sick all the time, and that's one of the criteria that I use to pick this protocol, especially if they're aggressive. Well, it was a complete turnaround. I mean, I saw a child who really, the two hardest things to take care of in autism are speech and language if they're apraxic. If they can't speak, there's nothing in our books that says it's going to make a child speak. And the other thing is behavioral aggression. Because what we really have for aggression is a bunch of medicines that either are stimulant medicines that slow you down and really fog your brain up, or medicines like for schizophrenia and strong medicines for your brain like Prozac and Zoloft, which are really not meant for little kids. So his was behavior. His wasn't much speech and language. It was more on the behavior side. And faced with the choice of giving a kid something that would make him stoned, basically, maybe more compliant but not as aware, I felt that this was again a great choice, and it did indeed change his life. I didn't know he was going to turn out, and Mom didn't either, to be a prodigy, but I do find that a large proportion of our patients, and I've taken care of a lot of pediatric patients over 40 years, a large proportion of the patients in the autistic community have almost savant type qualities about puzzles and about directions and about colors, and they do things that I could never remember, and so I think that part of their brain is working really well.
Jacob was born on September 29, 2007, and he was a healthy baby. All the hospital staff commented on what a good baby he was, and so then when we took him home, that changed pretty quickly. He started to become very difficult to comfort. He didn't sleep very much at all. He just always cried. He was always crying. And then about a month, when he was about a month old, he appeared to be choking one night. And
that's actually the first time I dialed 911 in my life. It was that evening. Jacob was choking, and it was the scariest moment of our lives, actually. And the paramedics concluded that it was the reflux. He was choking on his reflux. But I'll never forget that evening.
We were rushed to the emergency room, and then they confirmed that it was reflux, and so he started on medication for that. And then shortly after that, we realized that when he started on solid foods, he couldn't tolerate any solid foods. He could only eat very pureed baby food, and if there's any type of texture at all, he would vomit. And he was vomiting 3 or 4 times a day.
Yeah.
And
That's projectile vomiting.
yeah, he would turn purple, and it was like he was having trouble breathing. He would be coming out of his seat, and it was just very scary and very exhausting. And so we then found that he was diagnosed with a feeding disorder, so he had to take feeding therapy. And then shortly after that, they told us that he also was speech delayed. He was about 2 at that time. He didn't really start eating any solids until he was almost 3. He was eating pureed baby food. So, and then around that time, when he started the therapies, he started developing some other odd behaviors.
Right. He had an obsession with fans spinning. Certain things had to be a certain way. The light switches had to be on a certain way. Just things need to be placed a certain way. And if we changed any of that, it would aggravate him and get him quite angry.
Yeah, he would get very upset.
Yeah.
And then he also, we noticed he couldn't tolerate noises, like a blender or toilets flushing or vacuum cleaner or anything like that. And he would just cover his ears and scream. And then he started to get aggressive as well with us, kicking and punching and just being angry. And, you know, when I would ask him questions, he would say, "I don't want to tell you." Or if I said, "I love you," he would say, "I don't love you." And so then my husband convinced me that we should have him evaluated by a specialist. My husband had 2 older boys, so he had experience, and he just felt like this wasn't normal, the things that was going on with Jacob. And so finally he convinced me. We went to a specialist, and Jacob was 4 at the time, and she told us that Jacob had autism. And so we were just devastated, we just, couldn't believe it. And I went through a lot of different emotions, disbelief and anger. And, I was actually a month away from giving birth to our daughter. And so, and she was born a month later, and then his symptoms just got out of control.
When Skylar was born, Jacob's aggression got worse. The sounds of her screaming, crying, as a baby would just get him all the more aggressive. There were many times we would make certain that she wasn't anywhere in reach of Jacob, just in fear that he would hurt her, because it seemed as though that he would do anything that he could to stop it.
Yeah.
And his aggression, unfortunately, just progressively got worse and worse. Sounds bothered him more and more. He was very, he would run. He would take off. We had locks installed on our doors above high enough so that he wouldn't be able to open the doors, because he would just dart out.
Yeah, we couldn't go to restaurants. I couldn't even take him in the car with our daughter without my husband, because if she started crying, he would try to kick her or just throw things at her to make her stop. It was, and then if I yelled at him, he was throwing things at me, and it was very stressful.
Right.
So we were asking advice from other people. We didn't know what to do, and it was recommended that we try therapy.
Right.
And so we tried occupational therapy for about a month. And it just, even to drive to occupational therapy was dangerous, and I just wasn't seeing any outcome. And I felt like we needed something, done quickly, because this was, a scary situation for us.
And he, it's tough because he wasn't reciprocating that love, that, what all parents yearn for with their child, the reciprocation of the hugs and the, I love you and I love you back. And we weren't getting any of that from Jacob. The mornings every morning that Jacob would get up, we were always startled by the abrupt slamming of the doors, the holes in the walls
Yeah, the
that he
mornings
was
were the
causing
worst.
for just his aggression. And it's tough because, when you have a child that's, and you don't have that, and you just wish there was something that you can find or do to turn that around.
I decided to try to find some books on autism just so I could understand Jacob better. And I went to the library, and it just happened to be April Autism Awareness Month, and so they had a whole display of books, and I just grabbed as many as I could and brought them home, and two or three of them were on biomedical treatment for autism. And so as I was reading these books, it was just story after story of these children that had all the same challenges that Jacob was having, and these kids were getting better through different treatments that sounded pretty safe, changes in diet and, treating underlying causes like yeast or, bacterial infections or other things like that. And so I thought, well, this is worth a try. I mean, it sounds good, and it's working for these other people. And so I told my husband, I really want to try this. And so he said, let's go for it. And so I just started researching, trying to find a doctor, and we ended up finding the Child Development Center of America, which is Dr. Udell. And so I really wanted a doctor who was an MD that could prescribe medicine as well, and so that was Dr. Udell. And so we made an appointment. On the first appointment, Dr. Udell prescribed something called glutathione, and it's I was a little bit skeptical because this is a supplement, and what is this really going to do for him? But about 3 weeks into it, Jacob's language just started, it just exploded. I mean, usually on the way home he took a science class, and on the way home I would ask him, how was your day? What did you do in class? And he would either say, I don't know, or I don't want to tell you. And this particular day, he told me everything he did from beginning to end. And I was like, oh my goodness. I remember just staring at him in the rearview mirror, and I couldn't believe how he was answering me. And so my husband said, oh my gosh, the same thing. He's been talking so much. And so then the next visit, Dr. Udell told us, as far as, allergies, we should change his diet and things like that. And so we did. And then the following visit, I was all excited because I had something in mind that I wanted to try that I had researched. And so I went in there with my ideas, and Dr. Udell said, well, what's your biggest challenge with Jacob?
Because even at that time, he was still displaying a lot of aggression.
Yeah. So Dr. Udell asked me, what's your biggest challenge with Jacob? And I said, well, he has a lot of anxiety, he's aggressive, he always seems angry, he's aggressive towards his sister, that's the biggest thing. And he said, well, I think we should try this, it's called Naltrexone. And as soon as I heard that, I thought, Naltrexone, that sounds like a drug, and I got very upset. And I remember being teary-eyed and thinking that you're not supposed to be that type of a doctor, I don't want to drug my son. And he said, okay, calm down, this isn't what you think, it's a very low dose, and it's given at night in the form of a cream, and you rub it on the wrist, and basically smiling. At night, you rub it on the wrist of the child, and it blocks the endorphins for the first 4 hours that the child sleeps, and then when the body realizes that there's no endorphins, it upregulates and produces a lot more endorphins for the next 15 to 18 hours, and can actually benefit, and they're finding benefits in children with autism. So that night we rubbed the cream when he was asleep. We waited till he was sleeping because we knew he wouldn't let us do it while he was awake. We rubbed the cream on his wrists, and thought, we'll see. And then the very next morning, the first thing he said was, good morning, Mommy. Right. And that was, I thought, okay, this can't be happening. This has got to be a coincidence or something, because
it was life-changing. It was the first time that we weren't abruptly awoken by a slamming door.
Mornings are the worst for him.
Right, and it was incredible. I couldn't believe it.
And
it was
I mean, the rest of the day, he was good. He was happy. You know, he didn't like it when Skylar cried, but he didn't try anything aggressive with her. He would just say, "Mommy, Skylar's crying."
Right.
And I was still on, you know, automatically trying to stop her right away because I was afraid of what would happen. But he was so much calmer. And then, you know, each day that passed, we realized that it had to be the LDN because he never went back. He just got better and better. And then
we were able to go places with him, unlike prior.
Yeah.
We were able to go to restaurants and do the very things that we wanted to, and even take him to the very places that all children love to go and play. That we couldn't wait to take him. You know, to play video games. It's the little simple things. You know, ride on the go-karts. You know, things that we knew we couldn't take him because he was just aggressive. He was aggressive, and he'd take off and run.
About a month into it, he started to develop little bumps on his wrist. He started getting a rash from the medication. So we were devastated because we didn't, you know, it was working so well, and I couldn't imagine going back. And so we called Dr. Dell, and he said, "Okay, we'll try it in a liquid form."
Right.
And so we got the liquid, and that was even more effective. Then at that point, he started asking, you know, allowing us to give him hugs and kisses, and even asking for it, and saying "I love you." And I mean, this was something I thought I would never hear from him again. And so it was just incredible how much it changed his life and our lives.
We administer it at night, just before he goes to bed.
We put it in a little applesauce. And right before he goes to bed, we give it to him, usually 8:30.
8:30.
You know, give it to him, brush his teeth, and then he goes to bed. He sleeps great through the night. I think it may even help with that. And he wakes up the next day happy. And honestly, you know, we have done a lot of different treatments with Jacob, but LDN is by far the most effective. I mean,
we've seen the most results. By far.
I mean, most people would never know that Jacob was diagnosed with autism, 3 years ago, if they met him today. And honestly, I don't believe he would get that diagnosis if he were evaluated today. My husband plays, and so one day I was in the kitchen, and there was just Jacob and I here, and I heard the song my husband was playing the night before, and I thought, who's here? And so I went into the piano room, and it was Jacob, and he was just 3, just turning 4.
Right.
And so I thought, oh my goodness, Jacob, that's you? And I called my husband, and my husband started teaching him a few things. He was picking them up so quickly.
And we thought at that time, we then started looking for a teacher. It was hard to find one because at his age, there aren't very many teachers that wanted to sit with a then 3-year-old turning 4-year-old. But trying to convince them that, no, Jacob is quite unique. You know, he just has something special.
Yeah.
Then fortunately enough, we actually found someone who was actually willing to take him on. And she works wonderful with him. And since then, Jacob has excelled tremendously on the piano. He amazes me every day.
Yeah.
I mean,
he's playing Mozart, Bach, Beethoven,
Chopin.
Actually, he performed on Good Morning America,
we
View,
put
CNN, HLN,
local channels, local news. He was invited. He played on the Steve Harvey show as well. And it was amazing. We just put a YouTube video out there, and it just it went viral.
Yeah. I would say I cannot imagine Jacob performing that first performance on Good Morning America had he not been introduced to LDN. I
Right.
can't.
Most
I
definitely
don't
not.
believe that would have
We
ever
wouldn't-
been a possibility.
We wouldn't have been able to even get him on the stage, let alone to sit long enough for an interview.
Yeah.
And you know, going to these places, naturally there's a lot of noise and a lot of sounds. Yes, LDN has certainly made a big difference and has helped even in Jacob's ability to be able to sit down and express himself through the music, as opposed to perhaps maybe today. I can only imagine how many keys I wouldn't have on the piano had it not been for the LDN.
I have seen, aside from the rash from the cream, I haven't seen any side effects at all
None.
from
I have none
LDN.
either.
Yeah, so I would highly recommend it to any family, you know, touched by autism. I think it's worth a try. It's not expensive. We actually order our LDN from a pharmacy that's nearby, but we actually have it delivered. And I just, you know, Dr. Udell writes the prescription and faxes it over, and then
Compound.
it's a compounding pharmacy. It's not covered by our insurance, but it's pretty inexpensive. It's about $29 a month, and then we pay for the shipping because we have it overnighted. We choose to have it overnighted because we just don't want it sitting, you know, in the mail. Skylar is Jacob's younger sister. She's 3. We started noticing some delays with her at about 12 months, and she started seeing Dr. Udell, and we did a few things, and then after some blood work, we realized that she has a low immune system, and so Dr. Udell said, well, let's get her started on LDN, because that also helps with the immune system. And so at that time, Skylar wasn't aggressive or anything, but she used to just follow me around all day with her thumb in her mouth and just kind of whine. She just wanted to be held all day.
She wasn't a happy camper.
Yeah, and you know, I didn't quite notice an overnight change in her the way we did with Jacob, but she very shortly after that became very happy. You know, she entertains herself. She's a very happy child now. She still takes LDN. It did help her immune system. It's not exactly where we want it, but it's better than it was.
Much better. Yeah.
And she's the happiest child that we know. So I mean, I don't know if LDN will work for, you know, other children. All we know is that it worked for ours, and if you have a child with autism, it's definitely worth a try. I would say it's worth it. There's no side effects that we know of. It's not like a typical, you know, it's not a stimulant or an antidepressant or anything like that. It just seems so natural, and it's been a miracle for our family.
So if you were looking to try and start taking LDN, the side effects that you would be expecting to have most, possibly a mild headache, possibly a slight stomach upset, but these are generally very, very transient and go away within a couple of weeks. One of the most frequent questions we get is, which drugs can I take with LDN? And the answer to that really is almost anything, but you really have to check with a health professional first. Even if you're on morphine, or even if you're on tramadol, or one of these painkillers that all over the internet it says, no, you must never take it with LDN. If you work with us and or your health professionals, like your doctor or a nurse, there can quite often be a way of managing the regime of the way you take your tablets so that you are still able to take the drugs that you need for the conditions that you have. That being said, if you're on regular doses of painkillers that contain opiates, such as codeine, dihydrocodeine, tramadol, and you're taking those regularly and or have sustained release medications, most definitely do not start taking LDN without checking with a health professional first. People often ask us if you can take LDN with alcohol. Can I take a drink with this? There really aren't that many drugs that you can't take a drink with. So you can take alcohol with almost every drug that we prescribe if you want to. It's all about quantity. One glass of wine isn't going to do you any harm if you are taking LDN, but if you're drinking a bottle of vodka a day, it is going to do you harm. So it's what we say to most people, everything in moderation, but generally, as long as your liver function is okay and your kidney function is okay, you don't really need to modify your current lifestyle to take LDN other than looking out for certain medications, and that can be solved just by sending a list of the medications that you take to either a pharmacist or a doctor who's involved in the prescription or dispensing of LDN. Often people try to get prescriptions for LDN on the NHS. Generally what I would do is I would have a very frank discussion with your own GP explaining that you've tried X, Y and Z and the medications you've tried and the treatments you've tried that were NHS funded. I would then take with you an information pack such as the one provided by the LDN Research Trust. Ask the doctor to read through it and make a repeat appointment in a month or 2 months at their leisure. So allow the doctor to look at it, do some research on their own and find out in their own head how they feel about it. Inside the pack there will be contact numbers and email addresses for the doctor to contact other people in the LDN group. So for example, many of the phone calls I take every week are from interested GPs all across the country wanting to hear just a little bit more about LDN before they give it on the NHS. When the GP writes the prescription for LDN on the NHS, if they have to do it in a very specific way and they have to very carefully specify exactly how it's to be made and how it's to be done. And that is also available in every available information pack. So the short answer to that is you must go to your GP with lots of information and be prepared to wait. If you're unsuccessful in getting an LDN prescription from your NHS GP in the UK or in your country of residence, privately LDN prescriptions cost between £20 to £25 initially and then round about £20 a month for the actual medication. That can vary by about 50% depending on which formulation you're taking and how much you're taking, but it's really not very expensive to get it privately. The problem we have is that there is no proper clinical data, and because it's used for such a wide range of conditions, it's very difficult to pinpoint. However, my personal opinion is that if something makes people feel better and they can afford it and it's available, I don't think they should be prevented from trying it. And if it works for them, then I'm very, very happy for them.